Hello friends, welcome back to Multi-Question World. Today we are going to discuss important questions for various competitive exams of medical laboratory technology. Here we are discussing about 100 questions. If you are watching without subscribing, please do subscribe the channel, turn on bell button to get the notifications on time. So let's get started. Question number 1. Increased osmotic fragility is seen in iron deficiency anemia, thalassemia, sickle cell disease, hereditary spherocytosis. The right answer is hereditary spherocytosis. Next one. Which among the following is an example of supravital stain? The right answer is brilliant chrysite blue or BCB. Next one. Clot solubility test is used for testing factor 2 activity, factor 7 activity, factor 11 activity or factor 13 activity. The right answer is option D, factor 13 activity. Next one. Fetal hemoglobin in RBC can be demonstrated using. The right answer is option C, clear acid elution method. Fetal HB in RBC can be demonstrated using clear acid elution method. Next one. Increased relax formation in peripheral smear is suggestive of option A, multiple myeloma, option B, hemolytic anemia, option C, acute leukemia, option D, hereditary spherocytosis. The right answer is option A, multiple myeloma. Next question. Which among the following is an example of colored crystal in urine? Amorphous urates, cholesterol, triple phosphate, calcium phosphate. The right answer is option A, amorphous urates. Normal range of sperm count 60 to 150 sperms per ml, 60 to 150,000 sperms per ml, 60 to 150 million sperms per ml, 60 to 150 billion sperms per ml. The right answer is option C, 60 to 150 million sperms per ml. Next question. Which disease is caused due to human ingestion of eggs of Taenia solium? Cysticercosis, sporangiosis, toxoplasmosis, ascariasis. The right answer is option A, cysticercosis. Next question. Macroscopic examination findings on sputum analysis is include all except sulfur granules, Cushman spirals, broncholids, bronchial caths. Macroscopic examination findings on sputum analysis include all except. The right answer is option B, Cushman spirals. Next question. The urine preservative interfering with sulfosalicylic acid precipitation test for protein is option A, toluene, option B, formalin, option C, thymol, option D, chloroform. The right answer is option A, toluene. Next question. Which among the following infection is not usually transmitted through blood transfusion? Syphilis, hepatitis A, malaria, HIV. The right answer is hepatitis A. It cannot be transmitted through blood transfusion. Next question. The anticoagulant preservative used for storage of blood in blood bank is. The right answer is CPD. That is citrate phosphate dextrose. Next one. The gauge of needle used for blood donation. The right answer is 16 gauge. Next question. False negative result in ABO grouping occurs due to excessive centrifugation in tube method, dust or detergents in Slido tube, antiserum contaminated with another antibody, prozone or postzone phenomenon. Which of the following will cause false negative result in ABO grouping? The right answer is prozone or postzone phenomenon. Antibody or antigen excess will cause false negative result in ABO grouping. Next one. In hemolytic disease of newborn, direct Coombs test is used to detect sensitized antibodies in baby's serum, IgA antibody, sensitized RBCs in baby's blood or IgM antibody. The right answer is option C, sensitized RBCs in baby's blood. Next one. Which of the statement about tissue fixative is not true? Option A, preserves cells and tissue by preventing autolysis and putrefaction. Option B, hardens soft tissue. Option C, increase in temperature accelerates fixation. Option D, prolonged fixation preserves antigenicity well. The right answer is option D. Prolonged fixation preserves antigenicity well is not true about fixation. Next question. Which of the following is not a clearing agent? Ethyl alcohol, cedarwood oil, benzene, xylene. The right answer is ethyl alcohol. It is not a clearing agent. Next one. In histopathology, honing is a process of to polish knife, to sharpen knife by removing nicks, To trim the paraffin block or to embed impregnated tissue in wax? The right answer is option B. To sharpen knife by removing nicks. Next one, which of the following is a synthetic dye? Carmine, orcine, eosin or hematoxylin? The right answer is eosin. It is a synthetic dye. Next one, which statement is correct about alum in histotechnique? Option A, it is use the procedure of differentiation in staining. Option B is a dye which improves staining reaction. Option C is double sulfates of trivalent metals. Option D is bluing agent in staining. The right answer is option C. Alum in histotechnique is double sulfates of trivalent metals. Next question. Resolution of an electron microscope is expressed in millimeter, micrometer, nanometer, centimeter. The right answer is nanometers. Next one, which of the following is not a inflammable chemical? Either xylone, alcohol, hydrogen peroxide. Here, non-inflammable chemical is hydrogen peroxide. Next question, which of the following is not a carcinogen? Orthotoluene, picric acid, selenite, beta-naphthylamine. Here, non-carcinogenic chemical is picric acid. Next question, the temperature which is used in almost all investigations in laboratory, 22, 42, 56, 37. The right answer is 37 degrees Celsius. Next one, which of the following is not comes under moist heat sterilization? Hot air oven, autoclave, pasteurization, tintelization. Hot air oven is not a moist heat sterilization. So the right answer is option A, hot air oven. Next one, disposable plastics are sterilized by option A, alcohol, option B, ethylene oxide, option C, glutaraldehyde, option D, chlorine. Which of the following is used for disposable plastic sterilization? The right answer is ethylene oxide. Next question, a normal solution contains gram equivalent weight per liter, molecular weight of solute in grams per liter, option C, weight per unit volume, option D, none of the above. The right answer is option A, gram equivalent weight per liter. A normal solution contains gram equivalent weight per liter of a solution. Next question, average urine output of an adult per day, 30 to 60 ml, 500 to 600 ml, 800 to 1400 ml, 1000 to 2000 ml. The right answer is 1000 to 2000 ml. Next question, which of the following is not found in normal urine? Creatinine, uric acid, RBC, glucose. Right answer, RBC. Next one, which of the following is used to test ketone bodies? Rothera's test, Diazo test, Benzidine test, Ehrlich test. The right answer is Rothera's test. Ketone body is detected by Rothera's test. Next one, normal VMA level is? The right answer is up to 9 mg per 24 hours. Next question, normal GFR rate is 500 to 800 ml per unit, 1000 to 1500 ml per unit, 100 to 130 ml per unit, none of the above. The right answer is 100 to 130 ml per unit. Next one, bloody stool with pus and mucus seen in following condition except ulcerative colitis, mucus colitis, bacillary dysentery, carcinoma of colon. The right answer is mucus colitis. Next question, in amoebiasis, the cyst of Endomoeba histolytica identified from liver abscess, stool, lung abscess, all the above. The right answer is stool. Next one, which of the following parasite has no cystic stage? Giardia lamblia, Bacterium coli, Trichomonas vaginalis, Endomoeba histolytica. The right answer is Trichomonas vaginalis. It has no cystic stage. Next question, multiple ring forms are seen in which type of malaria? Plasmodium malariae, Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale. The right answer is option C, Plasmodium falciparum. Next one, LD bodies are seen in the reticuloendothelial system of human, redweed bug, CC fly, sandfly. LD body means Leishmania donovani bodies and it is seen in human. Next question. Which of the following parasitic ova is not bile state? Ascaris lumbricoides, Ancylostoma duodenale, Trichuris trichura, Tinea saginata. The right answer is option A, Ascaris lumbricoides. Next one, the causative agent of Calabar swelling, Wuchereria bancrofti, Brugia malai, Lova lova, Onchocercus volvulus. Right answer, Lova lova. Next one, night blood sample is collected for the diagnosis of malaria, filaria, trypanosoma, leishmania. The right answer is filaria. Next one, Cassoni's test is used for the diagnosis of hydatid disease, leishmaniasis, malaria, filaria. The right answer is option A, hydatid disease. Next one, which one of the parasitic ova seen in urine? Schistosoma hematobium, Fasciola hepatica, Paragonimus westermani, Clonorchis sinensis. Right answer, Schistosoma hematobium. Next question, the ratio of anticoagulant and blood used for ESR test is 1:2, 1:4, 1:8, 1:16. The right answer is 1:4. Next question, normal value of hemoglobin for an adult. The right answer, 12 to 15 gram percentage. Next question, normal platelet count. The right answer is 1.5 to 3.5 lakhs per cubic millimeter. Next one, glasswares containing organic matter are treated with 5% hydrochloric acid, 2% detergent, 2% phenol, potassium dichromate. The right answer is potassium dichromate. Next one, which of the following is not a Romanowsky stain? Leishman, Rice stain, Giemsa, Gram stain. Right answer is Gram stain. Next question, the main site of hematopoiesis. Liver, spleen, bone marrow, lymphoid tissue. The right answer is bone marrow. Main site of hematopoiesis is bone marrow. Next one, which of the following condition RBCs are microcytic and hypochromic? The right answer is iron deficiency anemia. Next one, eosinophilia is seen in allergic conditions, parasitic infections, Hodgkin's lymphoma, all the above. Eosinophilia can be seen in all these conditions. So the right answer is option D, all the above. Next one. Next question. LE cell are not seen in the following condition: infectious mononucleosis, SLE, rheumatoid arthritis, collagen disorders. Right answer is option A, infectious mononucleosis. LE cells are not seen in infectious mononucleosis as it is not an autoimmune disease. Next one, which of the following condition shows BJP or Benston's protein? Acute myeloid leukemia, malignant lymphoma, multiple myeloma, chronic myeloid leukemia. Right answer is multiple myeloma. Next one, APTT increased in following condition: hemophilia, vitamin K deficiency, liver disease, all the above. Right answer, all the above. APTT increased in all these following conditions. Next one, ABO grouping discovered by. The right answer is Karl Landsteiner. Next one, in a blood bank, CPD anticoagulated blood can be stored at 2 to 8 degrees Celsius for 2 days, 14 days, 28 days, 45 days. Right answer is 28 days. Next one, in pregnancy, the peak level of HCG in urine seen at 10 weeks of gestation. Right answer, 10 weeks of gestation. Next one, Cushing syndrome is due to. The right answer is excess production of glucocorticoids. Next one, in obstructive jaundice, which of the following serum enzyme level elevated? OT, PT, ALP, all the above. The right answer is all the above. Next one, normal fasting blood glucose level is. The right answer is 70 to 110 milligram per deciliter. Next question, serum uric acid level increased in gout, renal failure, Addison's disease, rickets. The right answer is option A, gout. Next question, Which of the following elevated enzyme level is not a marker of myocardial infarction? OT, PT, LDH, creatine kinase. The right answer is SGPT. Next one, increased level of PCO2 is seen in. The right answer is obstructive lung disease. Next one, torch infections are best analyzed by capture ELISA, competitive ELISA, immunocapture ELISA, streptavidin biotin ELISA. The right answer is immunocapture ELISA. Torch infection include toxoplasma, rubella, cytomegalovirus and herpes virus infection. Next one, the best diagnostic assay for infections and autoimmune disease parameters by EIA, RIA, fluorescence immunoassay, chemiluminescence assay. The right answer is option D, chemiluminescence assay. Next question, which of the following steps are included in PCR? Denaturation, annealing, extension. The right answer is option D, all the above. Next one, which of the following serological test is a specific test for syphilis? The right answer is option A, TPHA. Next question, the vector which transmits dengue fever, Culex mosquito, Anopheles, Aedes, Mansoni. The right answer is Aedes mosquito. Which of the following is not a rapid diagnostic test? Dengue check, lepto check, Paramax 3, Brussels RB. The right answer is option D, Brussels RB. Next one, significant titer of ASO test by latex agglutination is. The right answer is more than 200 IU per ml. Next one, route of transmission of hepatitis A virus is by contaminated food and water, blood transfusion, sexual contact, air. The right answer is option A, contaminated food and water. Next question, opportunistic infection associated with AIDS includes candidiasis, cryptococcosis, cryptosporidiosis. Right answer, option D, all the above. Next one, which of the following fixative contains picric acid? Bowen's fluid, Carnoy's fluid, Zenger's fluid, Lugol's fluid. The right answer is Bowen's fluid. Next one, frozen sections are obtained from histokinate, cryostat, microtome, none of the above. The right answer is option B, cryostat. Next question, the stain used to detect glycogen by Masson-Fontana stain, muscaramin stain, periodic acid shift stain, H&E. The right answer is periodic acid shift stain. Next question, the most common staining technique used in cytology. The right answer is option B, Pap-Nicolau staining. Next one, tubercle bacilli identified by. The right answer is option A, Robert Koch. Next one, Seale-Nielsen staining is used for the demonstration of mycobacteria. Right answer is mycobacteria. Next one, triple sugar iron agar contains glucose maltose sucrose, glucose mannitol sucrose, glucose lactose sucrose, glucose lactose maltose. The right answer is option C, glucose lactose sucrose. Next one, blood agar is enriched media, enrichment media, selective media, differential media. Blood agar is an enriched media. Next one, RCM is used for the primary cultivation of tubercle bacilli, Clostridium perfringens, Vibrio cholerae, Haemophilus. The right answer is option B, Clostridium perfringens. RCM is an anaerobic media which is used for the primary cultivation of Clostridium perfringens. Next one, which of the following sensitivity test is used to diagnose group A streptococci? The right answer is option C, bacitracin. Next one, ELEX test is used for the in vitro toxigenicity of Corynebacterium diphtheriae. ELEX gel is used for Corynebacterium diphtheriae. Next one, which of the following bacteria shows swarming growth? Swarming growth exhibited by Proteus. Next one, example of dimorphic fungi. The right answer is option B, Histoplasma capsulatum. Dimorphic fungi is Histoplasma capsulatum. Next one, Mantoux test is the diagnosis of tuberculosis. Next one, negative staining is used for the demonstration of. Right answer, capsule. Next question, the principle behind spectrophotometer. The right answer is Beer-Lambert's law. Option C, Beer-Lambert's law. Next one, which one of the following immunoglobulin can cross placenta? The right answer is IgG. IgG can cross placenta. Next one, which of the following condition shows 48 XXY chromosomes? Right answer, Klinefelter's syndrome. Next one, Negri bodies are demonstrated for the diagnosis of. The right answer is rabies. Next one, electrophoretic separation of major protein is known as. The right answer is Western blotting. Next question, which of the following is a non-nucleic acid based diagnostic method? PCR, LCR, RFLP, GLC. The right answer is option D, GLC or gas liquid chromatography, which is a non-nucleic acid based diagnostic method. Next one, monoclonal antibodies are produced from. The right answer is hybridoma cells. Next question, which of the following is not an automated culture system? BACTEC, BACT alert, ESP system, Castaneda method. The right answer is option D, Castaneda method, which is not an automated culture system. Next one, osmotic fragility test is used for the diagnosis of. The right answer is spherocytosis. Next one, hemolytic disease of newborn is due to ABO incompatibility, RH incompatibility, leukocyte incompatibility, none of the above. The right answer is option B, RH incompatibility. HDN is most predominantly due to RH incompatibility. Next one, which of the following automated system is introduced recently? Continuous flow analyzer, discrete analyzer, centrifugal analyzer, none of the above. The right answer is option C, centrifugal analyzer. The last question, Biuret method is used for the demonstration of. The right answer is option A, protein. So today we are winding up. You can watch the previous videos from playlist, and if you are watching without subscribing, please do subscribe the channel. And don't forget to turn on bell button, then only you will get the notifications on time. If the video is useful for you, please don't forget to like the video. Thank you.